In the US, 30,000 asthma attacks occur every single day. 5,000 escalate to emergency visits, and 11 result in a preventable death. Despite the widespread availability of advanced controller medications, the sheer volume of these severe, preventable exacerbations remains staggeringly high. The root cause of this persistent failure is a spatial mismatch in how we monitor environmental exposures. Standard environmental reporting provides a single AQI across a massive geographic zone, but asthma flare-ups are highly localized, triggered by distinct particulate clouds on a specific street corner. A citywide score provides virtually no predictive value for what a child actually inhales walking to school. To close this gap, the Impact DC Asthma Clinic pilot is testing a new thesis. Solving this mismatch requires a targeted application of environmental intelligence. Environmental intelligence converges three distinct data streams: mobile symptom crowdsourcing, localized IoT sensor networks, and direct integration into a patient's electronic health record. Pediatric asthma management has evolved beyond a purely biological challenge. It is now a geospatial data problem that demands a systemic, closed-loop architectural solution. Building this new data architecture requires first establishing a reliable dependent variable, which relies entirely on direct patient engagement. DailyBreath serves as the cloud-based ingestion layer designed to capture this human telemetry. This interface shows the DailyBreath risk index and prevailing environmental factors. It translates subjective patient experiences into quantifiable, geolocated data points. This Record Your Flare checklist allows users to log specific early onset symptoms, precisely when and where a trigger is experienced. Providing immediate environmental context alongside symptom logging creates a feedback loop that encourages active, continuous participation from patients and caregivers. The platform utilizes a family plan structure, allowing a single parent profile to actively manage and track the health data of multiple children. By decentralizing data collection to the smartphone, the system digitizes physical symptoms into precise spatiotemporal coordinates, readying the dependent variable for AI analysis. With the human telemetry established, the architecture requires an independent variable, hyperlocal environmental exposure data. Traditional stationary environmental sensors leave massive data blind spots across complex urban environments. To map these blind spots, DailyBreath partnered with Sparrow Analytics to deploy a network of mobile Sparrow node IoT towsers. These nodes are installed directly onto fleet vehicles moving dynamically throughout the metropolitan Washington, D.C. area, continuously scanning the air. The critical specification of this sensor network is its ability to capture both real-time and historical exposure data at a staggering 1-meter resolution. Instead of tracking general metropolitan smog, this resolution identifies highly specific, localized offending allergens and particulate matter directly at the street level. Sparrow Analytics effectively replaces a static, low-resolution regional map with a living, high-definition mesh of the exact air pediatric patients inhale. An AI synthesis layer then intersects the user's symptom coordinates from DailyBreath with the 1-meter Sparrow environmental telemetry. Algorithms analyze this correlation to detect the specific, localized pollutants responsible for flare-ups, eliminating clinical guesswork about what triggered an attack. This community symptoms map displays distinct color-coded pins representing geographically clustered flare-ups generated by the AI correlation. Functioning as a form of symptom crowdsourcing, it allows vulnerable communities to physically see and avoid high-risk exposure hotspots. The future application of this mapping will generate healthy paths, routing users around invisible pollutant walls during their daily commutes or outdoor exercise. This synthesis transforms retrospective medical data into a real-time preventative navigational tool, operating essentially as a GPS for environmental triggers. Most consumer health applications suffer from a structural flaw. The data remains isolated on the user's phone, entirely invisible to their medical provider. The final necessary layer of this architecture is direct clinical integration into the Impact DC workflow. The correlated environmental and symptom data is piped directly from the cloud and injected into the Epic electronic health record system. This gives the clinician direct visibility into the real-world environmental conditions that are actively triggering their specific patient's symptoms. Providers can now cross-reference controller medication adherence and rescue inhaler usage against a 1-meter map of environmental triggers. This integration elevates the physician from reacting to biological symptoms in an exam room to proactively managing a patient's environmental exposure in the real world. The DailyBreath and Sparrow system operates as a continuous, closed-loop feedback mechanism: patient app logging, 1-meter data correlation, Epic EHR clinician review, and predictive patient alerts. The final output is an automatic predictive exposure alert sent before an exacerbation even occurs. With advance warning, patients can implement upstream interventions, like adjusting their behavior or taking pre-medication, bypassing the acute symptom phase entirely. The Impact DC cohort pilot is designed to validate this exact parent involvement and systematically reduce preventable adverse outcomes. This architecture is built to directly reduce the 30,000 daily attacks, 5,000 emergency room visits, and costly hospital readmissions that plague the current system. By architecting environmental intelligence, we stop treating asthma attacks after the biological damage is done and deploy a system capable of predicting and preventing them.